That's great, thank you. And we've got some welcome slides. Thank you, Sarah. So welcome everybody to the virtual Parent Participation Conference with us here at Contact and the National Network of Parent Carer Forums. I'm Kate Lovelace-Collins, Head of Parent Participation at Contact, and I'm joined by the co-chairs of the NNPCF, Sarah Clark and Jo Harrison. Jo's already said a good hello. I don't know if you want to say a hello to Sarah or anything.
Yeah, no, hello everyone. We're looking forward to speaking to you all later.
It's absolutely fantastic that you're all joining us here live. On the next slide, I've got a few housekeeping little bits, just to say the usual things really. We will be recording the sessions throughout the day where it's appropriate, and we'll be uploading them to our website for people to view later if they couldn't make it today or if they're just some sessions that you can't make. Just to be as aware as well, as per the registration details, some participants may be using AI recording or note-taking tools to aid their inclusion and participation today. The usual thing, if you could please stay unmuted, if you could stay muted, not unmuted, while people are talking, just because that cuts down on the background noise and any unexpected interruptions. That's it really for the housekeeping. Before we carry on, I was just going to say a little bit about the agenda and what we've got coming up. We are going to hear from the NNPCF in a moment regarding the AGM, and then a bit of an update from us and the NNPCF together. So we'll talk about what's coming up, and we have a couple of questions for you as well at the end. And talking of questions, I did miss out the point about questions because my phone was ringing when I thought I'd already muted it. Sorry. If you do have any questions, we're happy to receive them in any way you want to ask them, really. If you want to put your hand up or put it in the chat or use voice, that's fine. So do ask a question if you need to. And if we get into a real discussion or anything, we can always park it and set up a separate discussion if we need to. So yes, we're starting off in a minute with the NNPCF. Then at between 1 and 2, we've got Alistair Durden, Head of SEND and Alternative Provision. He will be presenting on the Change Programme Partnership. A bit later on in the day, 3 till 4, we've got Catherine McLeod, CEO of Dingley's Promise. She'll be joining us to talk about supporting, talk about some of their fantastic work around the early years. And this session will start off with a video message from the Minister for Early Education, Stephen Morgan, who couldn't join us live but wanted to share his message. And then later on this evening, 7:30 to 9, we've got the NNPCF drop-in. So that's a chance for you all to be together with the NNPCF and your fellow forums. We at Contact will pop in, a couple of us, for a short 30 minutes just to say hi and answer any questions, and then leave you together. And so that's what we've got planned for the day. So just want to say again, thank you for joining us, and to head over to Sarah and Jo and the rest of the NNPCF for the AGM and hearing about your fantastic year and everything that's happened. Thank you.
Thank you, Kate. It does seem a really long time ago, the financial year 23-24. So we will do our best to go through it all with you. And things do feel like they've moved on an awful lot since then. So I'm Sarah Clark, one of the co-chairs of the NNPCF. And Jo, do you want to just introduce yourself again?
Hi, yeah, I'm Jo. I'm also one of the co-chairs of the NNPCF. My area is the East of England. Thank you.
And we have most of the steering group with us today as well. And I'll get them to introduce themselves as we come to their slides, because they're going to present on their regions. So what have we been up to in this last financial year? Government engagement has continued, as you would expect, but one of the highlights of the year was that we actually got to speak to the Permanent Secretary, Susan Ackloyd-Hood, which was really exciting, because that was the first time that we've been able to do that. We were able to chat to her at the launch of the Change Programme, I think that was last September, and get a meeting in with her to talk about some of the key programmes, particularly around Safety Valve and around DBV, which was really interesting to hear the DfE's viewpoint on how important those roles were and those programmes against what families were feeling on the ground and how that was impacting them. That was a really good conversation. There was a news article on it, which you can have a look at on the website if you'd like to. The Change Programme, that feels like forever ago. It was actually launched last September, and I'm really pleased that Alistair is joining us again, because he did last year, and the programme is probably going to change yet again, because of the new government, but there's been lots of key work that's gone on in that, and local parent carer forums have played a really crucial role in the aspects of that, and it's been really important that we've had their feedback throughout the programme to feed into the national viewpoint. Just to talk about the parent carer forums generally, as always, you play a crucial role in everything that we do, and it's really important that we keep hearing from you via the regions. Some of you contact us directly, which is great, and we feed all of that information into the regional and into our national work. We've also, under the new framework, we've been carrying out Ofsted and CQC surveys. So every time an area has an inspection, we send out a survey that we've been running. Thank you to everybody that's taken part in that. There was a report that I did on the first year of the programme, and we'll be due to send out a new report again for this calendar year. Sorry, it's getting muddled up within my different types of years. So this calendar year, we will be sending out the next one. We're also going to be working on a survey because Ofsted, as you know, are looking at the framework again. And we're going to be putting together a survey to go out to all of you to ask you your views on the framework and what you would like to see changed in that as part of the piece of work that we're going to be doing with Ofsted. So please keep an eye out for that because your thoughts really are important. We continue all of our other meetings as well. So we work very closely with all the consortium. We work with all our other stakeholders, and we continue to do that. Sorry, slides as well. Oh, hold on. Didn't realise it was going to come in stages. Sorry. So just a little bit of the data of the things that we do. We still, as you know, stick to our 9 regions. We have 10 steering group members, 2 of which in London, because they have 33 forums in their region. We've carried out 3,404 different activities, over 1,000 days worth of work across 69 work streams. And the biggest thing for me is that there is a membership of over 154,000, which is just phenomenal. And that number keeps increasing. It was a massive increase on last year. So it's amazing. And it demonstrates the work that's being done by forums and how important it is to parent carers that they're all joining us, which is fabulous news. Over to you, Jo.
Thank you. So just to give you a brief update on our finances and operations, we have reviewed our reserves and we've moved them across 3 different banks with dual signatories and with competitive interest rates, and that's mainly to ensure that we stay within the £75,000 limits for being able to recover funds back should anything happen within the banks. We've done an internal structure redesign, so we have consulted with our employees and our regional members, and we have streamlined our back office to our operational support team to reflect their responsibilities, and realigned what we're doing to keep the team afloat, and they do an absolutely fantastic job. We've looked at the way that we track our time. That's not only for our own purposes, but also for our accounting to make sure that we can better monitor the money that we've got coming in, understand what we're spending when we're looking at specific projects, and also that supports us to better understand our participation contract and how much money we need to look at that moving forward for contract negotiations. We are completing an IT review. We've now got an established support contract in place to support with our IT infrastructure, and we are continuing to review the systems that we use to ensure that we are streamlined and working as productively as possible. And we have launched a programme to enhance our data and system security as a result of that. Next slide, please. Just very briefly on the finances for the 12 months up to the end of the financial year in March this year, our income was £256,000. Mostly that was from the DFE participation contract and from NHS England. Of that, we spent £197,000 across wages, national insurance and pension, and other expenses, which were the face-to-face contract, our IT costs, professional costs, travel and accommodation, and tax came in at £69,000. So you can see how our finances are roughly broken down. And next slide, and back to Sarah.
So just a little bit about the general participation. We've expanded the national rep team to 20 in 23-24, which was amazing. We welcomed quite a few new national reps, which has been fabulous. We held a face-to-face event in London just to talk about the different aspects of being a national rep and what was involved and the different projects that were coming on. And they've contributed to 370 hours of work to all of the work and the meetings that we do, which has been a fabulous support to the NNPCF. We're also sort of expanding the roles that the national reps do, and they're helping us a lot more with some of the consultations because we lost our consultation lead, so they're now getting more involved in consultation work. So just a massive thank you to the contributions that national rep team have made, and to say if anybody is interested in becoming a national rep for the NNPCF, please do let us know, because we're always looking for some willing volunteers to come and expand the breadth of expertise that we have and help support the work that we do. Martin, I'm sorry, because I'm sharing my screen, I can't see. We're now going into the regional. Martin, are you there?
I am. Can you hear me?
I can hear you, yes.
Excellent.
I know you're in the car and you might have technical difficulties.
I am, so yes, apologies for being in the car. I was a bit worried the tech wouldn't work, but it seems to be. Thank you. So your Northwest region, hello. Yes, I'm Martin McAndrew. I'm the rep for the Northwest region. I think I can still say I'm new at the moment, maybe till the end of the year. So I'm just reading through this. Obviously, there's a lot of work that Kath had started and I've picked up. So I'll read through what's been going on in the last year in the Northwest. Some challenges first. So system change navigation, forums adapting to ongoing system changes and addressing community frustrations with services. So forums sometimes feeling under pressure really from their communities because services aren't meeting need, but find it difficult to influence because of system changes on a local level. So just recognise that there's some challenges around that. That leads on to the cluster model with the transition to ICB-based clusters in Greater Manchester, Cheshire, Mercia and Lancashire. A special thanks to Andrea, Christina and Jean for supporting with clusters with limited resources. So the clusters follow an ICB footprint, which is really helpful in navigating the system changes around the new ICBs. But again, that creates its own challenges and it's different in each region. For example, in Greater Manchester, you've got one ICB across 10 forums, whereas in Lancashire, you've got one forum across more than one ICB. So it's different in each region, the challenges that forums are facing. And just a big thank you to those cluster leads for supporting in me and Kath, obviously previously, in navigating that around the changes with ICBs. Again, some more challenges in the response. So our local send inspections in the Northwest were lower than expected, leading to new relationships and approaches for forums. Focus on supporting staff, mental well-being and trauma awareness. So a lot of that is around, because we've had more than expected poorer inspection results, whereas normally local forums might lean on each other if one's had a poor inspection result. You've got neighbouring areas that have all had poor inspection results, so there's less capacity for forums to help each other because they're all facing the same challenges. So just to recognise that. And also some challenges around with we have a large population in a small area, although it's a geographically large area, the Northwest. A lot of the population live in quite a compact area, so leads tend to move from local area to local area quite a lot, and that can present some challenges for forums with unsettled leads in place. Some really good positives though. So the sensory project was successful co-production at strategic and individual levels, building partnerships for better outcomes. It was a great project at Alder Hay Hospital, strategic involvement from the region and parent carer forum, local parent carer forums operational co-production, which then led on to the following project, which was the health and underserved communities, which was a really collaborative work on projects supporting travelling communities, refugees and parents with complex needs in partnership with Alder Hay, Edge Hill and Contact. This project was great. It really started with a blank piece of paper, identifying the groups that they wanted to target and support, and sharing the learning from this is how we can work together to influence change has been really positive. So I want to thank the whole team that were involved in that, and particularly thank Kath for all her work in putting these projects in place. And that's my update from the Northwest for now. Thank you very much.
Thank you so much, Martin, and well done for being able to join from the car. We do appreciate it. Take care.
Thank you.
Okay, so Richard unfortunately isn't with us today because he's at an IOS event in Bristol, I do believe, today. So you have me. Richard has asked me to just pass on his thanks to everybody in the region because they've worked really hard, and he's really enjoyed working with everybody within the region. They've had some mixed results within the SENS inspections, which has had varying amounts of difficulties for the forums. There's been a lot of regional collaboration, particularly around some of the health work around the dynamics support pathway and key worker projects, and that has actually been quite a positive influence within the region. They've all very much embraced the PINS project in several of the areas, which has been a positive change for everybody. And he says he's very optimistic about the future, and working with the Department of Education and the new NHS structures has actually brought about positive change and has helped the forums interact with health much more. Elaine, I shall pass over to you to introduce yourself.
Hello, so I'm Elaine, I'm from the West Midlands. So it's a long time ago, as Sarah said earlier, about like when this report was actually raised to. So in that previous year, we reorganised our regional leadership and have a new interim team who are still trying to figure out how the direction of the region is going to go. We didn't have the autumn event, but never mind, that was the plan at the time. So the big challenges we've had is that the loss of the SEND advisors from the DfE caused uncertainty within the region, and also our regional coordinator post changed with the introduction of the change programme, and so there's been lots of change of people strategically across the West Midlands, and them all trying to figure out what they're doing before they can involve us. But I think we're getting there with those relationships. Local area inspections. So the inspection outcomes have been mixed. They've got some. There's been some more since then that have been poorer, but those ones were overall okay. And change programme, Telford, Wrekin leading it with Herefordshire, Shropshire and Worcestershire. I think that's really helped those forums work closer together, which is positive for the region. And lastly, I just want to thank everybody in the region for working as hard as they are to make a difference.
Thank you. And Elaine, I'm going to apologise for my missing the E off your name. People do that to Clark all the time, and I'm really sorry.
All the time.
Yeah, it does to me too, but I'm really sorry. I should have known better. Okay. And over to you, Jo.
Hi, thanks. So in the east of England, we've had some leadership changes. I was previously the chair of the Eastern region, and I'm pleased to say, following my appointment, we've Sarah Conboy has now appointed as chair, and we have now a new vice chair, which was Sarah's previous role in Julia. We have also recruited a new regional representative called Lisa. We did also have Laura, but she sadly had to leave. And also just can't say anything without huge thanks to our secretary, Sylvia, who pulls us all together, keeps us on track, and does a lot of our administrative work in the background. And we also have our new contact advisor within the region, and it's appropriate to mention her as well. So we've got Olivia, and so welcome. And so we've got a new team leading us. We have a really strong relationship with health, and Julia has and Sylvia have been very hands-on, looking at the principles of good practice for the NHS in relation to health advice on EHCPs, which has been a brilliant piece of work. And we continue to be well represented across all of our health meetings, which means that we've got a really good, strong regional voice across our footprint for health. And that has also allowed us to secure £40,000 worth of funding from our region to support that collaboration, which we are extremely pleased of. And it also allowed us to give some money to our 11 parent carer forums to also support their individual ability to engage in some of those regional meetings. We are active in lots of forums across the east of England, and we have done several courageous conversations. Within this financial year, we had Norfolk and Essex, which was really productive, and we've also co-produced with our colleagues within the region a local authority guidance on using online assessments for EPs, which was again another piece of work supported by our regional reps. We have had lots of forum support talking about challenges with local authority, ICB turnover, which really impacts on the relationships and the projects locally for our parent carer forums. And we also used our a contact grant for some regional funding, and we brought IPSI in to do a face-to-face training day for 34 parent carer representatives, which was absolutely fantastic, allowing us to support the knowledge for our local forums to then go on and support their families, which was really well received and very well attended. And we also had a surprising visit from Her Majesty the Queen, who came and opened the newly refurbished community centre where we meet on a termly basis. And we were privileged enough to speak with the Queen and talk to her about the work that parent carer forums do. And we had some lovely pictures. Also, we did also get to meet Johannes from Strictly Come Dancing, who was also there, and someone from Love Island, but none of us knew who she was. But it was a lovely time. So thank you very much.
Thank you, Jo. I'll now hand over to Claire and Ross.
Hello, I'm Claire Richmond. I'm one of the two London region representatives. So to tell you a little bit about the work of our region in the 23-24 financial year, we run a 3-cluster model in London. As Sarah's already said, we've got 33 forums, so we meet in 3 clusters at least once a term. And we offer regular information and networking events across the region throughout the year. And some of those include the Send Law training we SoSend that we run annually to give forums an update on anything that's new and sort of consolidate their existing knowledge around Send Law. We worked with the National Development Team for Inclusion's London Region lead on the internships work programme, making sure that we met regularly as a region, so that to support her in understanding how well developed employment forums were and how well developed parent carer engagement was within those forums. We were, I don't know, fortunate or unfortunate that we had a few London forums that participated in the new inspection framework fairly early on in that inspection framework. So we created a webinar and a resource pack to help other forums prepare for their local area centre inspections under the new framework. And that was really well received. And we also reach out and support all our forums once we get that notification that they're going through the inspection process. We have quite a lot of regular strategic engagement in the region, and that includes a weekly meeting with our NHS London Region Quality Improvement and Send leads. Ros and I are part of the Learning Disability and Autism Partnership Board, and the final 3 is where a huge amount, it's a short list, but actually a huge amount of work falls out of the London Improvement and Innovation Alliance, Association of London Directors of Children's Services, and the Send Strategic Managers and Parent Carer Network meetings that we attend. So if you want to go to slide 2, please. Thank you ever so much. So some of the project work that falls out of that strategic engagement with those key regional partners are just towards the end of the last financial year. Ros and I joined the advisory group for the Mayor of London's Violence Reduction Unit Difference Matters programme, which is helping London secondary schools to create inclusive environments for neurodivergent children. We worked with the research partner MIME on a report about the state of inclusion in London schools, and it's taken a little while for that report to be published, but Ros and I were in Parliament a few weeks ago to present that report to London MPs. We've been involved in co-developing a Send leadership training course that was following workforce challenges that were identified in the the London Improvement and Innovation Alliance space. We've added a lot of value to that, and the parent participation in that has grown over the course of the development of the programme. And we've spent a lot of time working in co-production with health partners and trying to establish parent carer co-production in the, I want to say new, it still feels new, the new ICB framework. And in London, that's less developed than perhaps it is in other regions in England. So a few of the things that we've done there is to support each ICB with a partnership working event, to co-host a co-production in Send event with the London Region Quality Improvement Lead, and co-developed a commissioning spec for a video explaining what co-production is, and the actual filming and post-production of that fell into the current financial year, but it did start before the end of 2024. And that's us. Thanks ever so much.
Thank you, Claire. Over to you, Jo.
Thank you. So I'm here representing the North East and Cumbria on behalf of Gilly, who has taken some time to step back. So we are actually currently a vacant position within the North East and Cumbria, and we are hoping to look at recruiting for that in the new year. But in the meantime, just to let you know what was going on in the North East and Cumbria under the last financial year. They did do some local government restructuring, Cumbria's reconstruction, along with local area inspections within Hartlepool, Gateshead and Middlesbrough happened within the area, which promoted lots of conversation. They had a partnership conference which was organised in Leeds with the NHS, and that was about sharing good practice, co-production with local authorities, health, and obviously included parent carers. The North East was extremely pleased to be the host region for the NNPCF and Contact National Conference in Newcastle in the spring. So it was great to visit the North East for that, and it also meant that we had lots of North East parent carer forums able to attend in person, which was brilliant. They've had half-termly meetings, which has been fostering collaboration across the forums and strengthening relationships despite challenges. I know that the North East is quite spread out, and so having that chance to meet can be difficult for some forums that can involve quite a substantial amount of travel. And so again, thank you for the forums for making those efforts and working closely across the region. And the challenges, as I'm sure many of the regions will report, is local authority restructures and the ICB changes that happened across all ICBs with the reconstruction, with the restructuring that they did last year, which impacted work streams and compounded the cost of living crisis. And obviously thank you to the reps within the North East and Cumbria and the KIC, who also worked really hard to keep the region running. Thank you very much.
And now to my region. We have a new structure that we're still working with, where we have a regional chair. So Lisa was appointed recently. I think she's here today, so thank you for that, Lisa. And we have a steering group that helps lead the region, and we also meet every half term. And then the last one of in the summer too, we try and have a face-to-face conference, which we did last year, which was really successful. And we did some work around CEFs with our DFE send advisors, which we do very much miss in the region. I had somebody else mention that. We have really missed those particularly. We've really struggled with some of the RISE contract and getting that engagement. Under DBOT, we were part of many more meetings, and we've really struggled under the new RISE contract to get as much engagement as we would have liked. There are still, forums and different meetings, but they're not that engagement and co-production that we would like regionally, and I found that a bit disappointing. So we're working with our DFE leads around that. NHS collaboration, that's quite an interesting, it's a bit of a mixed bag. Regionally, we are doing much better. We work very closely with the region and our regional send advisors and we work well with those. We're struggling to get into some of the ICBs. Some of that has been down to a lot of the restructuring. Some ICBs have gone through not 1, 2, but 3 phases of restructuring, which has made it very difficult for forums to actually find out who they're meant to be, their contacts, and which boards they can sit on, etc. We did do some regional work, though. We did a couple of booklets. Thank you to Andrew and Gronya who wrote those for us around how to work with the forum, because we found that a lot of our NHS colleagues particularly didn't understand the difference between the local parent carer forum and working with experts by experience. And then the forums were also saying they found it very difficult to access the NHS. So one was created on demystifying the NHS to try and help forums understand their ICB and how to gain some access around it. And just to say a huge thank you to everyone, because our region do work really well together. There's a really strong peer-to-peer support, and that has been invaluable. And I know that most of the forums really do appreciate the information share. We don't reinvent the wheel. We do share information. The other negative thing that we've struggled with is a little bit with campaign groups. So we have really struggled in this year with campaign groups and some angry parents in some particular areas, and particularly where an inspection has come out as positive. So often where it's negative, it hasn't been so bad, although the campaign groups have been understandably angry. But in the areas that get a more positive result, actually it's created quite a lot of issues for the forum. So it's been quite a tricky balance to support those negative lived experiences of the families as well as the positive Ofsted inspection. I think it's me again. Yes. So as you'll know, Tina left us this last July, and Kenton took up post, but he's in Bristol at the moment on the IOS LGA event with Richard. So the region has really good, strong links with our health, and they do a lot of work with their health, and they've worked really well across the new RISE contract. They're a region that work very collaboratively together. They have a strong regional structure, although that is ongoing at the moment, and they are changing some of their structures at the moment. They've done lots of work around health, particularly with the admission avoidance, health passports, transition and autism to work. And a lot of the work that they do, and they do manage to obtain a lot of money from their NHS regional colleagues, which I'm a little bit jealous of in the Southeast, because we haven't been able to master that in quite the same way. But they do a lot of work. They have some really strong regional reps, and Kenton wanted me to pass on the thanks to the whole region for all the hard work that they do. Okay. Jane, are you with us?
I am. Hi, morning.
Hello, Jane.
Everyone. So I'm Jane. I'm from Yorkshire and Humber. And so rather than read from this slide, because you can see it and you'll get the slides, just to give you a feel, really, we have across Yorkshire and Humber, we have tireless, passionate, committed and equally knackered forums and parents, but they're making a difference every single day. And during that year, 23-24, you'll have seen already, there's such a difference across all regions, and equally within our regions there's such a difference across our PCFs. And so for us in Yorkshire and Humber, we've historically never received any funding, any external funding other than what's available through the priority grants. And so what we wanted to do was do a restructure. So we met monthly, but mainly as well to understand our demographic, to understand our parents, our families, what their priorities were, and how we could restructure and focus on supporting each other and sharing ideas and resource. Because even within a forum, it can be very, as we all know, it can be isolating and feel like nobody else is experiencing the same thing. So we wanted to come together as a region. Our priority that came out of that, we did do a restructure where we've now got co-chairs and policies in place to elect co-chairs and admin and finance. So we are ready to go out there and start asking them for money. But the biggest thing we'd come out with, that we wanted voice to effect change. And so we've done a biannual survey. So twice a year we run a survey, and that tells us the priorities of the local families. What is it that families are telling forums? The priorities of forums, what in terms of partnership, and where that partnership with different services is or isn't. The conference that was referenced with North Eastern Yorkshire, the North East came from, as you probably know, the ICBs restructure meant that now North East and Yorkshire is one area. And so together with Gilly and our NHS leads, we took this voice to our leads and asked for a conference, a partnership conference, because what came out of it was that only 3 out of our 14 PCFs were actively and consistently working or understanding what ICBs did. And that conference was very successful and the work's ongoing. The living experience that were being shared has always historically been around PFA and transitions and our young people being involved in that. And so we started the work earlier on. This is just for Yorkshire and Humber with I started the work with our DFE lead and took all that voice. It's about that voice impacting change. And we have just had an amazing conference 2 weeks ago, which has been led by our young people, called My Perfect Week. And for them, we're now looking at embedding that into across the region, and I believe it has already gone to DFE. I do need to say as well that all of this is very much done in partnership with our amazing advisor, Lisa from Contact, who's working with us and supporting us to make sure all of that's in place as well. But I suppose the biggest thing that we recognise is, I think that we've worked out that we have about 16,000 voices in Yorkshire and Humber, and that's who we represent when we take that voice to meetings. But we've just heard that we've got 154,000, and as the Yorkshire and Humber region, we join with the national network, and that when you are whatever you're doing every day, you are absolutely representing 154,000 families within this network, that we're doing this together. And so I just want to say thank you again to every single person, because every single person contributes to what we're able to do as your regional reps. So thanks, everyone.
Thank you, Jane. That segues really nicely into the next slide. If I can get it to, oh no, hold on, I've gone too far. Yes, into the next slide of thank you, which really, we can't do it without you. We can't do it without your families. We can't do it without the work that you do. We know that it's really hard out there, that you make money go stretch beyond anyone's belief. I never quite get over what amazing value for money the forums are. The work you do, it's tireless. You do it amongst your caring needs as well and everything else, and the ask never ever gets smaller. It's always, can you do more? Can you do more? Can you do more with less? And it is incredible, the work that comes out of the forums and the quality of that work as well. And I've seen it amongst loads of projects this year, PINS and the Change Programme and all the other forums that aren't even part of those as well. It is incredible amount of work that you do. The ask is always bigger. So it's just the final part is just a huge thank you from us to say well done, and we do really appreciate everything you do, the information that you feed us through, because we cannot do it without those voices and without understanding what's going on for you locally and in all the separate regions, because we are all very different. So thank you very much. And then Jo, I think you've got the first bit. You are on mute, my lovely. There's always going to be one.
Someone had to do it, and it had to
did.
be me, didn't it? So we really wanted to talk to you, and obviously the conference is talking about the year ahead, and I think we were slightly ambitious in assuming that the government would have a clear direction around SEND. However, we're not quite there yet. We know we've announced the budget, but we are still waiting for details on how those budgets are going to be spent next year, and confirmation around funding for priority projects, and how that's going to develop, such as the CPP and PINS. So for us, it's difficult for us to say what our priorities and our work plan is going to be for the next year, because we're very much dependent on the new government setting out its strategic ambitions for SEND, and plotting its way forward, so that we can then join in and develop and support and hopefully co-produce any reforms that come forward. So really, it's just to let you know that we are still very in early conversations with the government, and as soon as we hear anything and we're able to share, of course we will do, but we are still waiting for many of our national meetings to be, so my daughter's taxi's just arrived for school, so we are still very much waiting for our direction to come from the ministers, and then we will share it with you. Sarah.
No, we're going
I
to
think
Kate.
this was me.
Sorry.
Before I
Distracted by
come on
taxi.
to no, don't worry. Before I come on to the contract, I just want to say thank you. That was absolutely amazing hearing from so many people, and every single person that is on this call will have had something to do with what you've talked about there in some way or another. So thank you, yes, to everyone. And it's not ignoring that we're still in an extremely tough and challenging environment, but I think those numbers speak for themselves in terms of how powerful forums are and the movement that you are together. So thank you for that. And yeah, moving on to the contract. So I think as many of you will already know, Contact to the lead partner in the Department for Education consortium contract, which is about ensuring parent carers, children and young people are involved in the delivery of SEND services and provision in England and have access to information, advice and support. So we're currently working together with the DfE and all of the consortium partners, so the NNPCF, CDC and KIDS, to secure a contract rollover for the next financial year. We'll of course let you know as soon as we know anything more. I think it's fair to say that we're feeling positive about the rollover, and there's a lot of going on behind the scenes and a lot of information going over and conversations to really try and secure that as soon as possible. And we know that news is essential for you, just as it is for everybody. So we will let you know as soon as we hear more. The following year, there will be a contract retender. So this means it will be really important for us all throughout 25 and 20, throughout the 25-26 year, to carefully consider what we think that contract could look like going forward, to make sure it's useful for parent carers forums, as useful as possible. And of course, a very integral part of that is going to be talking together with you, hearing your experiences, your insights, your ideas, and to just look at that support offer and going forward. So that's a bit about the conference. I think, Sarah, you were going to, sorry, the contract, you were going to do the
Yes, we're going to look at, as part of that, what we're going to do is hopefully do a joint survey between the NNPCF and Contact, because we realise that there is a little bit of confusion around what a contact advisor does, what the NNPCF do within the region, to try and understand that. And also we want to understand the best ways to communicate with you, what's working well, what's not working well, what is going to be important for you in the retender when we look at that next year, just so that we can actually start collating some of that information now to make sure that we get the best contract we can for everybody moving forward. So I haven't written that yet, and it will be done in co-production, but if you've got any suggestions that you'd like to send to me around particular questions, please do email me, because I'm very open to hearing what we've got to say. And we have got a bit of a Menti survey a bit later in a second, hasn't it, Joe, coming up around, hopefully people can put some suggestions in there as well, but we're just basically starting that groundwork now so that we can make sure that the contract meets needs when we move forward, and we can tweak it as needed. Over to you, Kate.
Brilliant, thank you. So just a reminder that the face-to-face conference is coming up on the 4th of February. The planning's fully underway, and just a reminder really of the date is the 4th of February. That's a Tuesday, and the location is the Mercure Hotel in Northampton. All the information you need to book on is all on the website. So we're really looking forward to seeing you all there and just being able to be together in person. Massive thank you to everybody that suggested locations, venues and all that sort of thing. It's been really helpful. We did look at every single suggestion we had. We were, in the end, as you can imagine, highly driven by the budget we had to secure where we could go. But we're really excited to be going to Northampton, and we're looking forward to seeing you there.
Lovely, and thank you, Kate. So I just wanted to touch base. You might have seen on our closed Facebook page, we have just promoted 2 focus groups for the Law Commission. The Law Commission is reviewing the legal framework governing social care for disabled children in England. They're looking to ensure that the law is fair, modern and accessible, allowing children with disabilities to access the support that they need. So I'm sure that you would all agree that it's an important review. As such, we've invited the Law Commission to come and talk to parent carer forums, and the views that they collate at that session will will inform the review. So there's 2 sessions, because we understand that some parents and carers do work in the day. So we've got a session that's running from 12:30 to 2, and then we've got an evening session of 7 till 8:30. There are limited spaces on the sessions to allow for full conversation and collation of views. So if you're interested, please do go to our Facebook page and book on. And if you can't, I'll pop a link in the chat. So we do encourage everyone, if you can, to come and share your views. Thank you.
Brilliant, thank you. So I'm going to give a bit of an update on our offer and the handbook. I think I'll start with the handbook, if that's okay. So we are developing the Parent Carer Forum handbook. I mean, it's pretty new, you know, it needed an extensive update anyway because of how much forums have evolved and what's going on and all that sort of thing. So it is now in the draft feedback stage, and I do have a small number of spaces left for forums to be involved in reviewing and feeding back on the draft, where I can pay anybody can have a look at it if they want to, but the people I've only got a certain amount to be able to give that reciprocity and ensure people are paid for their feedback, because it's a lot to read and it's a lot to do. So if you are interested in doing that, please could you drop us an email, because I do need a few more people just to be able to look at that. People that are already in touch with me, you will definitely be getting an email very soon about a session where we'll come together to start looking at that. Just to say that with the handbook, it is going to be live on the website, and so even once it's finalised, we will be updating it regularly, but there'll have to be a big commitment to updating it regularly and keeping it as accurate as possible. And so this draft stage is to make sure the key messages are all correct and that we're happy with the overall ethos and advice that's in there. And then once it's out, it doesn't mean things can't be changed as well. So just to give you a bit of an update on that. Also, it's going to be live pages, it's going to be on the website, it's going to be chunkable, it's going to be printable in sections, but also printable as a whole. But the printable as a whole will come at the end, because otherwise, as you can imagine, we're going to be updating all the time. So the timescales for the handbook, good question, Bernadette, thank you. We haven't set a deadline for the feedback, because we initially set a deadline and it was really, really hard to get all of that sorted out. But we're going into the feedback phase now. We should have all our feedback by the end of the year. We'll be releasing it live early part of next year, but I haven't given specific dates yet because I'm a bit reliant on certain things coming back to me. So I could give some indication certainly before Christmas about it being released as a final for you to all see. But thank you. I've spoken to so many people about it, and I've got more people offering, and these conversations have been absolutely integral, and the feedback that's already been given has been extremely useful. So thank you very much, and do use the parent participation email account to let me know if you would like to be involved in actually reviewing it. And we can pay a small amount to your forum for your insight. So thank you for that. Other updates from Contact. The forum stories, your journeys and your experiences keep coming in, and we're putting them on the success stories page of our website. Thank you for continuing to do that. We've got a lot of leads to still write up and put on. We've recently had Cheshire West and Chester Parent Carer Forum using their survey data to influence change, and that's a lovely video on there, how they've used the DFE grant to function, and really, you know, what a crucial role for their forum that volunteers play. So that was a really interesting one. Devon Forum have got a partnership around the Devon Ambassadors Volunteer Programme. That's gone up there, and we've got a lovely story from St Helens about their process of change. So that's really we're continuing to update that, and we're going to update the page to make it more accessible over the next few months as well. Online learning sessions coming up. We've got 4th of December, measuring the impact with Data Orchard, which is an online learning session taking place, and that'll be between 12 and 1:30, and we've got one coming up about our survey says. So that's a basic online learning session for anybody that isn't already well versed in doing surveys. If you've got anybody in your forum that wants to learn more about that, that's another one that's across lunchtime, but of course these will be recorded. so that you can watch them back. Training, the Leading a Forum training and the Parent Rep training will be happening at the beginning part of next year. So Leading a Forum training is likely to start in January through to March, and Parent Rep training Feb through to March. So watch this space because we'll be contacting with invites and how to register for that. You're probably already aware that we have the KIC and Community Matters subscription services as part of what we offer forums, and we've heard anecdotally like mixed experiences of those offers. So there will be a survey coming out soon to find out what you think about those, if you've accessed those or if you haven't. So please look out for that and do fill that in, so it can help us to tweak things or to make considerable suggestions or changes for when it comes to retender as well. I've whizzed through that because I want to make sure I'm leaving enough time for the next bit, which is where we get a bit of interaction, which is probably the best bit. So thank you all, and just to say, keep communicating with us and let us know, you know, anything that we need to know regarding the offer and feedback on our approach and everything. We do appreciate hearing from you, and we're looking forward to seeing you for real in February. Thank you.
Oh, sorry, it's me. So thank you, everyone. And thank you to the steering group for presenting, and thank you, Kate, and thank you, Helen, for doing all the background work for us as well. So just a little reminder that we've got at 1 o'clock, we've got Alistair doing the change programme, followed by at 3 o'clock, we've got the Minister recording along with Catherine McLeod from Dingley's Promise. And then tonight at 7:30, we've got the drop-in with the NNPCF and with Contact. Joe, have you got your Menti survey? So we're now just going to do a little, we're going to go into questions and comments, which we welcome, but we're also going to run a little Menti survey. Do you want to explain the Menti bit?
Yeah, if you want to just take this down and I'll bring the Menti up. No, you're all right. So if you have any questions, please do pop your hands up. We're happy to answer, and from anyone here. So if you wanted to ask a question of your regional rep, you're more than welcome to do as well. And what we wanted to do was, in our Menti, is we've got 2 questions. What is working well for your forum? And if you could change one thing, what would it be? Just to really hear what's working really well for you in your areas and what you want to change. So if you could please get involved, that would be absolutely amazing. Our Menti code is 3452 2808, and I have put the link in the chat, and there we go. Helen's also popped a link in the chat for us as well, so please do get involved. In the meantime, if anyone has any questions, please do pop your hand up, and we will try and make sure that we unmute and put you on the camera, if that's okay. Did anyone have any questions? Okay, while you're having a think, I'm just going to have a look at what some of our pet forums are telling us that is working really well. We've got a new office and a new director for our CIC. That is fabulous news. Reaching parents and helping getting their voices heard. That's brilliant. Committed volunteers. That's also brilliant. We know that volunteering in the current climate is extremely difficult. And so to recruit volunteers is hard, but to make sure that they are committed and able to give you the time you need is really hard. So well done there. Massive improvements to co-production locally, and hopefully some funding. That's brilliant. Well done to you. The PINS project has really helped us to get more links with schools and raise awareness of the forums generally. That's really good. Sarah, I think you're finding that that's quite a common theme, isn't it, from forums around the PINS?
Yeah.
So
it's been a really big ask, the PINS on the forums, and it's been a project that's been at pace. But yes, we're receiving some really positive feedback around the parent care engagement, the links with schools, the improvement in communication for families just within schools, which is no mean feat. So it's been very, very successful.
Brilliant. Thank you very much. Oh, we've got a question. Helen, are you able to? Helen's our technical person in the background, so she will take you off mute, hopefully.
Everybody now has the option to unmute themselves.
There you go. So everyone should have the option to unmute yourself. And if you want to pop your camera on, you're more than welcome to do so. But if you're not speaking, we do ask that you remain on mute. Nabila, and if I pronounce that wrong, I completely apologise. But would you like to ask your question?
Yes, thank you so much. Yes, my name is Nabila. That's correct pronunciation. There's a quick question. Actually, I have two questions. The one is, you know, when we attend the meeting with the local authority at strategic level, and we just look at the policies, let's say transport policy and other policies, and it's very clear, even though when you look at the NHS policies or their contract, when we raise questions about the therapy packages for the children delivering in the mainstream schools, it's very clear that these contract or these policies are not aligned within the law. Okay, despite challenge them in a not in a more positive way, you know, working in a partnership, your policies are not aligned within the law, your contract is not. It's just like they listen and then they ignore. So how we can handle the situation? Do you know what I mean to say? Yeah, that's the first question.
Thank you, Nabila. What I will say is that there is a great organisation called Centas that does a great deal of work around local authorities. And in fact, he's actually following some tribunals. He's actually working quite closely with some local authorities now as a consultant. He does a lot of work, a lot of free work as well for parents and carers. So that could be a really good organisation. I'll pop the names in the chat. I think other than that, it's about having a really constructive conversation and calling out, you know, and saying this is parts of the policy we feel is unlawful and this is the reasons why, and having those conversations. Sarah, did you want to come in and offer
the one
any
thing
advice?
I suppose I would say is that, you know, policy doesn't trump law. And no matter what they put in their policies, it doesn't trump law. So unfortunately, often that particular local authorities will think their policy does trump law, and it will take families challenging that on an individual basis if they're not willing to listen to you, which is the worst case scenario. But hopefully by constructively challenging them on it, you will get somewhere.
Lovely. Did you have
you.
a second question, Nabila?
Yeah, the second question is, you know, at the moment we are going with our SEND strategy, which is going to be like for 5 years. And we invited to be the part of this. And to be very honest, they're kind of constructive. However, when we ask them, you know, if they can discuss with us the previous SEND strategy, if they achieve the target or not, and if still relevant, it's just like we kept asking since we started work with the new strategy. It's just like either they are not really interested, and then my concern is like it shouldn't be the paper practice, you know. So previously, when the previous forum involved, it's just like such a long time we are spending with them, and it's just, if the strategy is just for the papers only, that's fine, because it's really important to look at your previous policy, if you achieved or not achieved, and if you didn't achieve, then why, and how you are going to make sure you are going to achieve the new actions you are putting in. But we are not really receiving a positive response from them. Is every time they listen and ignored.
I suppose I've experienced this a little bit, but I think that for me, over the years, what I've learned is policies are policies. Some local authorities like to write a lot of them, and actually we tend to focus now on implementation plans. So
Okay.
I wouldn't worry about what went on in the past, because they're clearly not going to give you that information, and and in some ways that's semi-irrelevant, isn't it? What I would say is, what's the implementation plan? When are we doing what, where, and how are you going to evidence that it works for Ofsted coming? So that's the tact I would personally take. I would say, right, what are we going to do? When are we going to do it by? And how can we prove to Ofsted that we've been successful and we've demonstrated good practice, and that we understand our families and the needs of the area? And that's the focus I would take.
Yeah, thank you so much. I really, you know, appreciate your.
Hopefully that's helpful. Jo, was there anything you wanted to add to that?
No, not at all. That's lovely. Thank you very much. We've got a question from Elsie. Elsie, did you want
Elise.
to?
Sorry,
Elise,
it's one of mine.
sorry.
Hello, Elise.
Oh, that's okay. Don't worry. I've been called Elsie so many times. I do apologise. I am home, so the camera is off. I just had a couple of questions and really thinking about the year ahead. So it was kind of reported that we're seeing really poor results when it comes to send inspections, any kind of inspections really. And I do think that we're seeing this due to the new format they're using. And if we're seeing less good practice and less good practice that we can share between forums, surely this is something that we should be kind of monitoring and watching and reporting back, because I think the send inspection results, even for us in Portsmouth, were quite shocking and surprising. And then it's trying to work on things like the change programme. You're trying to share good practice, but actually what good practice are we sharing?
No, I agree, Elise. So we do you probably had the survey, didn't you, around how forums found the process, etc. And we do talk to Ofsted about the themes that we hear through the region. So we do have regular meetings with Ofsted, so that is being discussed. And I don't know if you've noticed that there have been changes in the way they present their reports. So sometimes forums are named. We've had conversations about whether that's a positive and a negative thing for forums, because it has led to in certain cases, I can think of a couple in the southeast where the forums have then been attacked by campaign groups because of what's been written about the forum in the inspection report. And we are working really closely with them, and the survey that's coming out around the new framework will also feed into what they're going to change within the current system as well. So we are looking for your feedback, and I do completely agree with you. It is tricky, but one of the things I've really noticed in the inspection reports is the joint working. So there's a massive focus now on the joint working and the joint commissioning. And my personal view on a lot of the inspection reports is that planning hasn't been done, or place planning and provision hasn't been done since 2015, since we had the reforms. And that is what's catching out most of the local authorities, because they haven't even looked at what they need, and they're always on the back foot. And that data behind it really does drive quite a lot of the work. Whether they pay attention to the data is a different question, but they don't actually have to understand their local areas. And the joint commissioning is a massive thing that's going to come out in the new inspections, I think. Does that help?
And my second kind of, that really does help. Thank you. So my second thing is, I think Sendias was mentioned just now, actually. So for us, Sendias is commissioned by the local authority, and it's not commissioned very well. And as a parent care forum, we do a huge amount of work that actually they should be doing as a service. We refer people to them, and they refer them back to us as a parent care forum, which is increasing the demand on the parent care forum. And I'm just wondering how it's never really been made clear to us as a parent care forum how that kind of working alongside Sendias should be, because for our local authority, it's very much that you work alongside, it's co-production. Actually, they're not commissioned in a way that they can provide the service that they need or that the families need. So I'm just wondering how, if it's possible in the year ahead, to kind of how parent care forums support that service, and how Sendias can support as a parent care forum to be really clear about the understanding of what we are doing and what we should be doing, if that makes sense.
That makes perfect sense. And I think it depends on your working relationship with your SNDS team, to be honest. Locally, we sit on their steering group. We have really close connections with them, but we have quite clear lines around what is and isn't our role. And they are underfunded. They do need more, I don't know a SNDS service that doesn't need more staff and that isn't struggling at the moment. I think it's having that conversation with your local SNDS service around what you want to do, what they want to do, and how you work together. We work very closely with ours and feed in similar information, but in different ways, and work together that way. Jo, would you like to add something to it?
Yeah, there's also there's a core offer that Sendias have to offer. And when we undertook a review of our Sendias in my local forum, we established I think I'm speaking from memory here, but I think there's like 10 things that they have to do, and they were only doing about 6 of them. And we were able to use that as the parent carer forum to argue for a business case for additional funding for the local authority and to support that. So I think there's something around asking your SEND-IAS, you know, what are their core roles and what are they actually doing and what are they not doing, because I think there's quite a lot of amount of what they're funded to do that they're not actually able to do. So I would welcome that conversation. They also have a wider network of feeding in, and they've got regional support and national support as well. And I know our SEND-IAS used that again to support the development of the business case with our backing. But again, locally we have very different views, but we work together a lot on some joint projects, and there is mutual signposting. Sometimes if someone just needs a chat, wants to get involved, they signpost to us. We don't offer advice as our local forum, and so we signpost on. So we've got a very clear divide over what our roles are. And I think, again, as Sarah said, that's come from us developing a really good working relationship with them, doing joint events in person and online, and having that ongoing dialogue as well. Hope that helps.
No, that's really helpful. Thank you very much. And thank you to the comments in the message as well. Thank you.
Brilliant. Thank you very much. Much appreciated. I'm going to go to a couple of comments on the screen just to encourage some more, and then I'm going to come to you, Jane. Thank you very much. Just a couple of comments from the screen. We've asked, and please do use Menti and join in. If we don't read all of your comments, it does actually help us when we're having those conversations with the DFE. Kate's nodding furiously there around what's working well for forums and what isn't. And so people have talked about, what one thing would it be if you could change one thing, what would it be in relation to your parent carer forums? Lots of you are putting funding, and I couldn't agree more. HR support, that's really interesting. And more mini forum clusters and forums being more confident in sharing. I would say that's a really good one for us to pick up as our regional leads. And how can we support you regionally within our regions as the NNPCF to be more confident in sharing? So that's something that we can take away from with us, with our Contact regional leads and the NNPCF. Jane, would you like to come in and ask your question?
Yeah, sorry, it was more, I can't, you know me, Mrs. Technical, I can't type in the chat. So it was just something to add to Elisa's question. So, because we had exactly the same thing, Elise, in my forum in Rotherham, and we have an MOU and a memorandum of understanding now with SEND-IAS. That's a very clear partnership and an official document, and it works really well and is reviewed every year. So I'm more than happy to share that. I couldn't put it in the chat. We're just that, and there are probably other people as well. It is about this, isn't it? It's about sharing what we know is working. But I'm more than happy to share that if that's useful too, because SEND-IAS service would recognise the language, and obviously SEND-IAS's input into that memorandum of understanding.
Thank you, Jane. Much appreciated. Does anyone else have any more questions? We've got another 18 minutes of the session, so there's plenty of time. If you have any more questions you want to ask, or if you've got any views on the work of Contact and the NNPCF and what we can do to support. Bernadette, hi, from Kent.
Oh, it's Bernie. Come on, Bernie. Hit us with it.
It's really southwest today.
She's one of mine. Come on, let's hear it.
Come on, East of England. Come on, North East. Let's get some questions in.
Let's go.
Come on, Bernie, go.
I can't believe I've waited this long. No, I'm joking. Sorry. Okay, so yesterday I attended the DFE. What did I attend? Curriculum review. Sorry. You know when you're having those days and you think nothing's working, particularly my tongue. So I attended the DFE curriculum review for the South East of England, and I asked them a question about, you know, in Kent we've got 23,000 EHCPs and we have around 18,000 children and young people on SEND support. And I said, in the curriculum review, what are you doing about SEND, and what's your engagement with in SEND, you know, with more formally? And they seemed really, really keen, but I sort of don't believe them. Not that I'm cynical or anything. Not they, you know. Yeah, sorry.
Love it, Bernie. Brilliant. Elaine is leading on it nationally. Would you like Elaine to talk about some of the work?
Yeah.
Are you happy to talk about it, Elaine?
Yeah,
I know you're
I can.
leading on it nationally.
Yeah, so I'm currently plowing through all the questions and trying to come up with some sensible answers, but lots of questions seem to repeat themselves. I was like, I've already told you that already, and I'm typing it again. But so I went to the similar event in Northampton before half term, and Gary Orban was there. He's the person on the board of the review who is the SEND expert. He is very, very passionate that the system needs to be better for SEND. I shared a video from him on the closed Facebook group 2 days ago, Monday, I think, yeah. So you can share that with anybody and encourage them to put it in. He wants as many SEND responses as possible. So if you can fill in one for yourself, fill in one for your forum, fill in one, get your children to fill one in, use the easy read versions and email those in, because they're easier than the 30,000 Brazilian questions. So yeah, so he's very keen. I'm a bit cautious because they're talking about evolution, not revolution, and I think that actually the curriculum and assessment process needs a bit of more shaking up and down than I think they're going to be. I don't think they're going to be brave enough with it. That's my personal view from hearing what I'm hearing, and I think there's going to be lots and lots of trade-offs. So I'm not really sure. I'm not really confident. I went to that event really excited about it, but I'm not really left reassured that actually they're going to make a big difference. And they're not just going to talk about it lots and then go, actually, it's too hard.
Yeah, that's sort of the feeling I got, and pretty much everybody in the room. So we had the meeting at a huge SRP school in Folkestone, and pretty much everybody in the room talked about the same thing, around, you know, the amount of young people that aren't able to access the curriculum. And what that looks like, and the funding issues that mean that they don't access as well. So, but I feel like it's a really important area that we don't have the capacity to sort of cover that in the same ways. I'd love to be able to, but if they're going to change the curriculum, and I mean they were quite candid about 35% of young people aren't accessing the curriculum. So I think it's a really important area for the NNPCF and Contacts even to be involved in.
Yeah, we are trying. We will feed into the consultations, and we have direct, or Elaine does direct communication with those that are leading it. So we are feeding into it, but I think it's going to be, how brave is this government going to be?
We're also part of SEC, and they've put in a comprehensive thing with like actual evidence to like actual research and stuff, which is like, so they've sent that in. Lots of other SEND organisations have sent it in. I think Gary's spoken to Fleur and to kids, so the kids can participation group have put in a response.
Yeah. I mean, I will encourage, and the closing date for consultation, I think, is Friday. But if anybody does get 5 minutes to look at the easy read, even, I think it's really worth putting something for, you know, all of the forums, putting something in. The more we do, the more they hopefully will listen. But
so maybe it might be a good idea, Elaine, if we could post again on the closed group. Would you be happy to do? We could send an email out via Contact and via the NNPCF reps as well, just to remind everyone that the closing date is, and say go for the easy read, because at least it's quicker.
I can put something together from comments.
That would be fabulous.
Yeah, yeah. Just say I know Contact are work. You know, the rest of Contact are working on it as well, and I think they've put something out to like remind parent carers on the Facebook group and all that as well. And they're trying to influence. You know, we're the other team are trying to influence around that. So if I send you what we're doing as well to the NNPCF, just to make sure we've got that as well. It's a good point. Thank you.
Thank you, everyone. I just want to pick up a comment in the chat from Jane asking about wider work around in health, thinking about physical and complex needs. We know our NHS colleagues have a very strong LDA programme. There is a consultation out at the moment, I think, around the long-term plan. Yeah. I'm certainly arguing that it goes from LDA to neurodiverse. Whether I'll get my wish or not, I don't know. But it certainly needs to be spread out wider. But what I would say is, if you're looking to find some hooks to get into some wider work, I would use the fact that each local area now has to have a designated senior responsible officer for Down syndrome. And so what work are they doing to support that community? And there's also a great pathway in Barnet around around support for Down syndrome. And there has been some national presentations done by NHS England around support for Down syndrome. So that could be something that you could link into, Jane. And another one that you could use, especially around physical disabilities, is around, there's a cerebral palsy framework that's come out. It doesn't seem to have sat well with SEND. My ICB argued that just because you've got cerebral palsy does not mean you have SEND. Completely agree. However, what I would say is that a high proportion of children and young people that have cerebral palsy also have SEND. And therefore that it is a really important piece of a framework, and certainly something you can have some conversations with. There's also a lot of information around dental and eyesight within special schools. Lots of work going around in dental on and around, so that's really positive. And in relation to physical and complex needs, another thing that you could look at and have conversations with is the Core 20+5 work that's going on in the NHS England. Again, wider work streams, particularly around things such as asthma, and there are looking at physical disabilities, epilepsy, but again, all of these conditions impact on SEND. So how can we use that Core 20+5 work to influence the supports for SEND? So I hope that helps with some information there. Nosheen, is again, if I've pronounced that not correctly, I apologise, but Nosheen, would you like to come and ask your question?
Yep, you've said it perfectly fine, Jo.
Thank you. I always panic.
Yeah, don't worry. So Nosheen from Swindon, the PCF. I was going to say, actually, we've got good relationships with our local authority, ICB. I think up until a couple of months ago, we've had a head change of SEND, and things seem to have gone a bit quieter. And we've got a potential SEND inspection coming up, maybe February time. We don't know yet, but things are a bit quiet on our side. Even with the PINS project that we've been heavily involved in with the schools, we only had one meeting with the LA to get some input to create a document for EACNA, but again, very quiet. So I'll send an email, won't get a response back. I'll resend it again just to sort of remind people. And it's a bit worrying because we've done so much hard work over the past few years. And I'm just worried more that it's going on a landslide, and I want to keep it on that high for us as well. Potentially for the SEND inspection. I know it's the LA that gets inspected, but we're part of it as well as a PCF. You know, as a PCF, I think most people would agree that we're volunteers and we work so hard. I think, you know, what we do and it's like the heart and soul of everything, isn't it? We carry what parents and carers are trained. We want to support them. So I think my question is more with approaching the LA. How do I take it forward? Like I've emailed yesterday the director just to make her aware what was going on. But again, I'm just a bit concerned that this has happened, really.
I would suggest you get in touch a little bit with Kenton, because he's your Southwest NNPCF representative, and he will know your local area and your LA a lot better than we do on the national front. And he may know some individuals that might be good for you to make. It's finding those officers, those key people that get co-production, get parent care forums, and can help sort of champion what you need to be doing. If you've got any issues, I put the PINS email address in the chat. So I lead on the PINS work for the NNPCF. So please do email me on that email, and I can do my best to support you around the PINS work. And Jo, what would you like to? I think it's just chipping away at it. It's never easy when officers change and you have to keep rebuilding those relationships. It's a bit soul destroying at times, and it is the core resilience of forums.
I think like we had our meeting just say mid-September, so I actually requested they got cancelled till October, so the person just settles in, gives them a bit of time. So I didn't want to push them in saying these are all the concerns going on, but like we're looking at mid-November now, and I don't think we're going to get one until Jan now, maybe. So we've missed like a whole term. So for me, that's what my concern is.
And I'd also work on what you would like to see and who you'd like to work with, and what are the key projects that you want to see. So as well as raising the key concerns that you've got, I would say this is how we'd like to work together. So I would work with your steering group around what you would like to do and how you'd like to work together, and see, so that they understand where you're coming from and what your expectations are around communication and the projects and the capacity that you have as a forum.
Okay.
Jo, did you have anything else, or Kate, did you have anything that you'd like to add to support, or anyone else actually got any other tips that they'd like to add? Everyone's gone really quiet. I can't have had the perfect answer.
Seems as if you
Got a
did,
good point.
Sarah. So just for that guidance, it is the that I just referenced. I've just sent it to Kate. If you can pop it in the chat, because it's too long for me to type and I can't share. But it's the executive lead roles with the integrated care boards guidance that lists out who your senior responsible officers should be. And I found it a great piece of guidance to use to have those wider conversations around health services, particularly for children and people with Down syndrome. Just having a look, it's really great. Sue's put in here about having co-production training together, so they're on the same page. I think that's a really great idea. I know locally when we start a project, we look at reconfirming what our expectations of co-production is right at the very beginning, because if we do that, then we tend to find that we're not falling out halfway through the project, because we all know what everybody's expectations are with regard to working together. We've also got some other really good comments on what is working well for your forum. I'm loving reading these. They've got the band app for the parent reps and steering group communication, which is great. I've heard great things about the band apps. The band app. The NHS and County Council are co-producing events for families with us. That's really good. I hope they're giving you the funding for those as well. Building strong relationships and co-production after push from us, positive meetings and now regular meetings in the calendar. That's really good, and hopefully that Nasheen will give you some inspiration and show, as Sarah said, he's just about chipping away and keeping those conversations open, and the tides will turn. The relationship with the LA is improving, and the DFE is starting to better understand the role and importance of the forum. I'm assuming that's in relation to SEND inspections and the ongoing work. But again, that's a really positive. So thank you very much for sharing. And again, if we could change one thing, what would it be? Improved co-production with social care and funding from them. Social care, we hear a lot that we tend to speak with the local authority around education and health, and we do know that getting into social care is more difficult. Again, have a look at the Law Commission and the social care review for disabled children. Hopefully, maybe you can use that and the outcomes from the review to support those conversations locally. Another thing is around funding. Now we are an employer, it's just not enough, the £17,500 from Contact to support the forum, and we are hearing that more and more. And the recognition that we are not simply just a bunch of mums, sometimes dads, sometimes carers. But again, it's about ensuring that we've got that dedicated funding, and that is something we are hearing time and time again. And I know Kate is really looking at those conversations to ensure that when we come to contract negotiations, that we are being able to share those views, aren't we, Kate? For the
yes, definitely.
Do you want to say something
definitely.
about funding?
Yeah, I mean, I was just writing in the chat, definitely hear you on the funding. And I know Carolyn, she's doing, because we're the lead, she does the main communication around the consortium, and I know that's been fed in at the highest regards, you know, several times. I just put another comment in there though, because this comment here, you know, formal recognition in the highest and widest sense about what a PCF is. You know, some of all the challenges that people talk about and not being sort of listened to, you know, that those sorts of things. It's the how. I think about that comment there a lot, and it's the how, you know, and where and how we do that together to sort of push so that forums are better received initially. and so that more parent carers actually want to that they're received well. I that's the sort of the comment that keeps me up at night, really. So yeah, ideas around that and how we might do that together, I'm really interested in. I'm interested in all the comments, but that one just grabbed me. Yes, yeah.
And Bernie, it looks like you're going to get the last word as we're coming up to a minute. Come on, make it a good one.
Look, I'm sorry. Okay, so I just want to say something about the formal recognition. I mean, our area has been pretty toxic for years. We're the 5th iteration of a parent carer forum, and I'm not even sure I'll survive, to be fair.
You will. You're doing an amazing job. You have really turned it around. Don't undersell what you've done, Bernie. It's been phenomenal.
Yeah, we've done a great job, but it's the continuity and keeping the continuity. So, you know, currently I sit as the co-vice chair of the Strategic Improvement Board, but you know, we do get funding. We do get funding, but our county's huge, and just the spread is impossible to actually do that strategic work, the co-production. We're actually writing the co-production charter because, you know, the RISE project was such a failure. It's, you know, 2 years on almost, and it just wasn't done. So, you know, we're doing a vast amount of work, but there isn't really the recognition, and parents are still getting a hard time, and we're getting a hard time from parents too. So it is like being in the stoning pit half the time. And it's a really tough place to be. And I think it's totally demoralizing for, you know, I'm struggling to get any staff, get volunteers. They don't even want to admit they're volunteers.
Yeah,
it's that toxic in Kent.
You have had it very tough, Bernie, but when I went to the LGA at Harrogate, you know, I had one of your councillors come up and recognise the amazing work you were doing. I know I emailed you, but I'm going to remind you that tide is turning, whereas your councillors were often memes, as are many of our councillors end up as memes, but you have done such a phenomenal job. You inherited a very difficult landscape, and I'm in awe of what you have done to turn your forum around. You have done an incredible job, and I know it feels like an uphill battle, but you are getting there. Those tides are turning, and I do think you need to celebrate what you really have achieved, because you have done an exceptional job. You really have, Bernie, and they should be tears of pride, my lovely, because I am so proud of what you've done, and you really should be proud of yourself and your team. You've done phenomenally well. It has been a really tough couple of years for you guys. You've done exceptionally well.
Yeah, thank you for just being there. But I think it comes back to my point that,
and I'm always on the line. You give me a ring when you need to.
Yeah,
you know where
it shouldn't be that. It's an absolute gift to services, to the government, to our society, really, that parent carers are even there, or even performing the role of the forum. And yes, the funding's not enough, and and you're covering massive areas, but the culture of walking in that room and not being listened to and being dismissed or worse I think we need to band together around trying to influence that culture, because there's challenge and there's logistical challenge and there's problems, but that culture costs nothing to be able to be welcomed in, to be valued for your experience and what you bring is extremely important. So yeah, I'm interested in us taking these sorts of conversations further, and I know I will with the NNPCF and forums, because we're already talking about these sorts of things. But just thank you for being there, and it's not unnoticed by us, and it's why we're all here, and you're not alone. You're part of a
and I think we've gone through this cycle of, we go through blaming education, blaming parents, blaming the local authority, blaming health, and it seems to go through whoever's the bad guy at the moment, who we're going to pick on. And actually it's not a single point of failure, and it's certainly not the parents' fault, because they didn't create the system, but there's not a single point of failure in the current system, and if it was, it'd be much easier to fix. It's around that joint working, and actually for the partners, I hope is the bit that I really want to see change, is that the solution comes with us all working together, including the bit that the Parent Care Forum does about the reality of those decisions that they make, and the actual genuine impact that has on families, on individual cases, and the forum, and that amazing work that you can't co-produce when you're angry, and the forums are phenomenal at filtering out that anger and coming up with amazing solutions that are cost effective and actually fix things and make things better generally across the board. It's what you do really, really well, and it's just so important, so important. But Bernie, hang in there. I'm always at the end of the phone, and we know that we love you because you're doing a fantastic job.
Lovely. Thank you very much. Well, we're 4 minutes over. And on that note, just wanted to say on behalf of both Contact and Sarah and I and all of the amazing reps that we've gotten from Contact and our steering group from the NNPCF, thank you very much for coming. Do reach out if you need any advice. There's lots of questions in the chat, and I know there's been lots of support to reach out and exchange messages. So please, if you have any questions that have been answered, do reach out to your Contact representative or your NNPCF representative. We're all here to answer and support those questions, and we hope that you can join us in some of the sessions later on today. So thank you very much for joining, and we really appreciate you taking the time to come today. It is much appreciated by all of us. Thank you very much. Bye now.
Take care, everyone. Bye.
Thank you. Bye-bye.
Thank you, everyone. Bye-bye.
Bye.